Dear partners, colleagues, and friends, while we prepare to simultaneously celebrate World Leprosy Day and Neglected Tropical Diseases World Day, my thoughts go to those who experience leprosy and other entities. On this day, I celebrate the resilience with which people who experience NTDs fight its devastating consequences, survive, and support their peers. Their fight is the fight against social injustice. Leprosy and other NTDs are in many senses the consequence of the endemic social injustice that persists in shaping our world. Entities are classified as such because of the low priority they are given in the context of global health, which together with limited resources of middle and low-income countries leads to gaps in health systems and coverage that severely impact groups of people that already struggle with multiple barriers to access fundamental rights. NTDs share one same pattern of deprivation, structural disadvantage, stigmatization, poor access to state services, disability, and diminished participation in decision-making. Allow me to share the testimony of a remarkable woman and leader affected by leprosy, and I quote, "Society outcasts me. Even if I am allowed to live within the household, I am like dead. Not getting involved, and no opinions are asked of me. I got the disease in childhood. I was denied education. It was like a predestination because of the disease. I have been hiding inside the house, but men within the household take advantage of me. They intimidate me and they also sexually abuse me. They think that people like me must accept that." Please note that this woman lives in one of the dozens of countries that keep discriminatory laws against persons affected by leprosy in force. Discrimination is indeed the key to understand both the underlying causes and the harmful effects of NTDs. It is time to put a stop to this. We have the instruments such as the NTDs Roadmap 2030, international human rights law, and we have the political commitment embodied in the Sustainable Development Goals. We need action. Action that promotes material equality through redistributive policies that can guarantee a minimum standard of living to persons affected by NTDs, alongside equitable access to public goods and services. Organizations and networks of persons affected are a key resource to strengthen action and its reach. Undeniably, while it is true that discrimination is deep-rooted, the willpower of affected communities and people is twice as strong. Indeed, today we have you, a vibrant NTD community that has raised the issues of equitable access, stigmatization, mental health, gender-based violence, among others. A community that is able to ensure one of the more important mechanisms to democracy, accountability. So let us be guided by this community and join efforts to fight endemic social injustice and make real a people-centered paradigm that puts the well-being of persons, communities, and populations first. I wish all of us a very successful World Leprosy and Neglected Tropical Diseases Day.